In the next 8 minutes, you're going to understand something about your own brain that most people never figure out. This is Cognitive Thread, and today's topic is: the United States is facing a severe and growing shortage of medical doctors who specialize in adult mental health care. Research provides evidence that the demand for these medical professionals will sharply increase over the next decade, while the available supply decreases. In 2019, Sarah Chen, a psychiatrist in Portland, Oregon, made a decision that would haunt her for years. After 15 years of treating patients with severe depression and bipolar disorder, she walked away from medicine entirely. Not because she didn't care, but because the system made it impossible to care. But what Sarah didn't know was that her choice was part of a much larger pattern that psychologists are only now beginning to understand. Sarah's story isn't unusual anymore. In fact, it's becoming the norm. Right now, across the United States, there's a crisis quietly unfolding in mental health care. The demand for adult psychiatrists, medical doctors who specialize in treating mental illness, is skyrocketing. At the same time, fewer doctors are entering the field. Even worse, experienced psychiatrists like Sarah are leaving faster than new ones can replace them. The numbers are stark. In 2020, the American Psychiatric Association reported that the U.S. had roughly 28,000 psychiatrists, but to meet current demand, we need at least 31,000. By 2033, we'll need approximately 48,000. That's a gap of nearly 20,000 doctors. For context, that's more psychiatrists than currently practice in Canada. But here's the thing nobody wants to talk about. This isn't just a numbers problem. This is a psychology problem. And to understand why, we need to go back to one of the most revealing experiments ever conducted in the field of organizational psychology. In 1974, psychologist Roy Baumeister and his team at Case Western Reserve University ran what seemed like a simple study. They brought college students into a lab and divided them into two groups. One group was told they could choose any task they wanted to work on. The other group was assigned tasks by researchers. That's it, simple choice versus no choice. What they were actually measuring was something far more profound: the psychological impact of autonomy. The students who had choice reported enjoying the task more. They stuck with it longer, they produced better work. But most importantly, they felt less depleted afterward. The students forced to do assigned tasks, they felt exhausted, drained, even though the actual work was identical. But this is where the study revealed something that would explain decades of workforce behavior, something directly relevant to why doctors are leaving medicine today. Over the next 20 years, researchers like Edward Deci and Richard Ryan expanded on Baumeister's work through their self-determination theory. They found that humans have 3 core psychological needs: autonomy, competence, and relatedness. When any of these are missing, motivation collapses. People don't just work less hard, they leave entirely. Now apply this to modern psychiatry. A psychiatrist in 1980 had significant autonomy. They decided how to treat patients. They chose their schedule. They had real control over their work environment. They also had competence. They were the expert, trusted by patients and colleagues. And they had relatedness. They built deep relationships with patients over years. But psychiatry transformed. Today's psychiatrist works in a system controlled by insurance companies. They see patients for 15-minute appointments, sometimes less. The insurance company, not the doctor, decides what treatment is approved. The psychiatrist becomes a prescription dispenser rather than a healer. They have minimal autonomy. Competence erodes too. How can you feel like an expert when you have 15 minutes to diagnose complex conditions? When insurance denies the treatment you recommend? When you're forced to see 40 patients a week just to keep the practice financially viable? And relatedness? Nearly impossible. Long-term therapeutic relationships are replaced by rapid-fire appointments. The human connection that drew most doctors to psychiatry in the first place has been systematized away. Dr. Constance Horton, a researcher at Johns Hopkins, studied burnout in psychiatrists between 2018 and 2022. she found that 63% of psychiatrists reported symptoms of burnout. But here's what's crucial. It wasn't the difficulty of the work itself. It was the lack of control over their practice. Psychiatrists with more autonomy reported half the burnout rate of those in corporate healthcare systems. The system itself was psychologically crushing people who chose this profession specifically because they wanted to help others. Think about that paradox for a moment. We created a mental health care system that systematically strips away the psychological conditions necessary for psychiatrists to feel motivated. Then we're shocked when they leave. We're almost there, because the answer to why America's mental health care is collapsing involves something that applies far beyond just doctors and hospitals. Sarah Chen, the psychiatrist from Portland, didn't leave because she stopped caring. She left because she was no longer allowed to practice medicine the way she was trained. The autonomy was gone. The competence felt hollow. The relationships were shallow. She was experiencing what researchers call moral injury. The psychological damage that happens when you're forced to act against your values in a system you can't control. The research here is devastating. A 2019 study by Christina Maslach, who literally invented the concept of burnout, found that moral injury in healthcare workers isn't fixed by wellness apps or meditation. It's fixed by changing the system. But our healthcare system isn't changing. It's accelerating in the opposite direction. The reason the psychiatrist shortage is worsening isn't because fewer people want to be doctors. It's because the system itself is psychologically incompatible with human motivation. We built a machine that requires compassionate experts to run it, while simultaneously removing every psychological condition that allows humans to feel motivated. So what happens next? If the trend continues, and there's no evidence it won't, we're looking at a decade where mental health care becomes a luxury only wealthy people can access. Waiting lists will stretch to years. Emergency psychiatric care will collapse further. The very people most desperate for help will be least able to get it. But here's the uncomfortable second question. If the research shows clearly that autonomy and competence are essential for motivation, why hasn't the healthcare system changed? What forces are keeping this broken system in place despite the evidence? Because that answer might make you question what other systems in your life are built on the same broken psychology. So Sarah Chen left psychiatry not because she stopped caring, but because the system made caring impossible. The research is clear. Strip away autonomy and you strip away motivation. But this same mechanism explains why so many intelligent people feel trapped in careers they chose. And the patterns go even deeper into how entire systems can be psychologically designed to fail. We'll explore that dark side of organizational psychology in our next investigation. If you want to understand the psychology behind why people quit their dreams, subscribe.